And
that's pretty much.
that's pretty tight.
Oh, wow.
And that's a lot better. And that got it tighter. Here's the one thing that really upsets me when I see it with physical therapists, just like myself, chiropractors, personal trainers, and even physicians. They try to diagnose what the problem is, especially at the pain site, and then they come out with a plan and then they execute that plan. And most oftentimes it might be a hit or miss. Either the patient gets better or the athlete gets better, or sometimes they don't get better at all. But then as we see that the athletes and these patients don't tend to get better, there's probably a lot more other things that are missing during their assessments. So the one thing that is probably the most important, which I tend to teach this into my mentorship program and to all my students, is history taking. History taking is by far the most valuable tool to collect data, to know how to solve the pieces of the puzzle to the patient's problem, which can be pain or stiffness or immobility. You see, your history, and when I say history, I'm not talking about the history of the current injury. That's one part. I'm talking about your history of whatever happened to you since birth. You see, I don't care if you were 4 years old until when you had an ankle sprain. You may have fractured an arm in the past while you were 6 or 10 years old. Any stressor that has been brought to you in your life is what matters and has to be documented down. The only reason why I say this is because I tend to focus a lot on the brain. Now, when I say brain rehab is not to restore the brain, we're trying to use the brain to restore and fix ailments on people with movement problems. You see, that's why we cannot focus solely on just biomechanics. You have a lymphatic system, you have a neurological system, you have a circulatory system, your cardiovascular system, you have a respiratory system. All of those systems have to communicate well together. You see, the brain is the boss or the commander for your arms, legs, and your trunk. It tells it how to move, when to move. It tells what things are safe and what are not safe. But the arms, legs, and the trunk also provide information to the brain. And that's not just the arms, trunks, and the leg. That's also your eyes, that's also your ears, such as sound or your vestibular system, your balance, smell, taste. All of that stuff can give you issues to biomechanics. It might give you shoulder pain, it might give you back pain or neck pain. Whatever I see or whatever I can't see well, whatever I can hear well, whatever I can't taste well, whatever I can't feel well. So anything on the external environment also has to be documented as, do you have vision problems? Do you have hearing problems or balance problems? So your history matters a lot. So I've had a couple of students of mine that would show me their documentation on history taking, and it was barely a paragraph. Your history should be at least 2 pages long of documentation of all the data that you've ever had in your life. The only reason why I say this is because you want to imagine your brain being a bucket. If I have a bucket and I'm going to throw in there past ankle sprain when I was 10 years old, IBS for years, anxiety, family problems, surgeries, vision problems, balance problems, all of those things in your life fill up your brain, and then your brain starts to spill out a response. Can be pain, can be stiffness, can be immobility, dizziness, high blood pressure. These are outputs. Pain, for example, is an output. It is your brain's response to something threatening. So our job is to minimize as many threats as possible, which means let's tackle something that has happened to you in your past that can present to you with a current issue. If you had a bad ankle sprain in the past and you come to me 10 years later and you complain to me about shoulder pain and nobody has ever done anything to that past ankle sprain, you just kind of walked it off, then if I start working on that ankle and you start noticing changes on your shoulder, that means that that thing is ridiculously linked to your current issue. So history taking, it may sound boring, it's not sexy, but is by far the most valuable tool to use because it gives you clues. Success leaves clues, just like Tony Robbins. For you guys, I actually have something really nice for you. I've created a document for you to show you guys exactly how I document my assessments. In there, you're gonna find perfusion index, like their oxygen saturation in their blood, blood pressure, their vision, specific eye tests, their balance. I check the vestibular system, cranial nerves for smell, taste, hearing, reflexes, deep tendon reflexes, sensation on the skin and even muscles, right? What kind of good sensory input are they getting into the brain? And I'm gonna give you a little bit of a sneak peek of what the skin, for example, can do to a bad shoulder, for example. So in this document, I have made it so simplified for you guys. It's like a little guide that's gonna give you a lot more information that you probably bypass while you're doing your assessments in your office. So this way it's gonna give you a lot more clues and a lot more options to explore. If one technique fails with this shoulder problem, there's something else that I can use here. I'm gonna call out one of my guys here that has I don't know how long, I'm gonna take a little small history of his. He's been complaining about some shoulder issues. I've never treated him ever. I just saw him. He's actually my camera guy. And I just noticed scars on his shoulder, on his arm. And I'm like, there might be something going on there that he's not even telling me. I didn't even ask him anything. So I want you guys to see a little bit of how his shoulder can be impacted by sensory input. And that is all part of my documentation in my history taking. So I'm gonna call out here Rahman. All right guys, so I got my guy Rahman here, and he's my camera guy, and he never complained to me about anything. But again, when he walked with his guns out, nice and sunny out today, I saw some scars on his arm. And I'm like, do you have any shoulder pain? Do you have any shoulder pain?
Not yet. Maybe not even that I can noticeable, but I think I just maybe get the shoulder pain. It's just daily routine. I just get used to it, but it not means that it's normal, let's say.
I see. So some discomfort sometimes,
yeah,
right?
Maybe.
Okay. Do you notice that when you're doing any kind of pressing?
Sometimes actually, yeah, maybe some limitations maybe as well.
Limitations.
To some, like depth fullness, let's say maybe.
Got it. Okay. Again, I'm not taking a very big history on Rahman, but what I want you guys to see is how surface level stuff can impact deep joint issues. So if he would ever come to me and I have to take a thorough history, one of the sections in my history taking is sensory of the arms, legs, and the trunk. Do they feel light touch on this good arm as opposed to the bad arm? Do they feel equal? Do they feel something vibrating as intense enough as the good arm? If I put heat on his arm, on the scar site specifically, does he feel the intensity of the heat on this arm as good as this one? So we're gonna check out Rahman's, we're gonna check his shoulder mobility, we're gonna do internal rotation, and we're also gonna check out a little bit of his neck. So I would say, if you can face me, give me a right arm. Let's start with the right arm. Right arm, let's see how far down it goes. So I'm just checking his internal rotation.
Yeah, pull this further.
Pretty good there, right? And why don't we face that way so you can show me the left. All right, so we check out his left. And that's pretty tight.
Yeah.
Okay, and why don't we face the camera, and how about you check your neck side to side? Let me know if one side feels tighter than the other. That's to his left. That's to the right.
I think,
Going to the right. Okay.
Yeah.
So I could do a lot more movement assessments, everything, but I want to keep it simple. Now I see a number of scars here on his bicep. I also see it on here on his brachioradialis. I'm gonna go to this small one right here. So what you guys are gonna see, this is the stuff I teach in my mentorship program, is when it comes to scar work, I know that skin has a lot of mechanoreceptors. It receives information that goes to the brain. But a scar, his mechanoreceptors are all kinds of messed up right now. He doesn't know, he can't feel the same good stuff sensation-wise on the scar as opposed to healthy skin. See, right now, if I tell him, you see how that feels? It is, right?
The biggest part here,
yeah, you go.
If we're gonna touch, is exactly feel like kind of like numb feeling.
Numb, there we go. So if he's getting a numb response to his brain is gonna give him bad movement. So when it comes to a scar, the skin, actually this scar is actually a burn scar, right? And how long ago was this?
I think I got it when I was maybe 2 or 3 years old.
2 or 3 years old,
Yeah.
Okay, so it's been a minute.
It is.
So these are burn scars, and you see that a scar is not like a nice, healthy looking skin, it's all kind of mushed up. So some mechanoreceptors, others have been stretched, others have been mangled. I have to move around that skin to see what is his brain like now. So I'm gonna go to this small one right here. And what I do is I just touch the scar and I just wanna see how it moves. Up and down, in and out. Both down and up feel kind of tight. So I'm gonna pull that scar down. And let's check your neck, side to side. Let me know if you feel a difference there. Okay.
Oh, yeah.
A little bit easier, right?
Actually, yeah.
All right. And I'm gonna, for shits and giggles, I'm gonna try and push it upward. Did it get better or worse? I think that looks a little worse.
It's actually slightly tighter.
Slightly tighter, all right. So I have to pick directions. Up, down, left, right, down left, down right. So far, straight down was best. Let's see what that does to his shoulder. So why don't we face that way again, since the left shoulder was a problematic one. Bring the arm up. And I'm going to, hopefully you guys can see there, I'm gonna push it down and let's give it a go.
Oh, wow.
And that's a lot better, all right?
That's completely different.
All right, now face the camera again. Now I pulled straight down. Let's see what happens. Do I have to get more specific? Do I have to do down and in or down and out? So from here, down and out. Let's check the neck again. Right. How about last one? Oof, this one's a little tighter now.
Yeah.
Go. Tell me, is that better or that one? Go again.
The first one.
The one I did previous, right?
Yeah.
Okay. So for him, straight down was okay. Down and out was even better. So I'm gonna check out his shoulder again. Let's face that way. Bring the arm up. So now I'm gonna pull it down and out and give it a go. Still good, right?
I can pull it even further.
All right, very good. Now if I pull that skin in a different direction, go again. And that got it tighter. Yeah. That's what happens when I pull the scar up. So what does that mean? Sensory input, stuff on his skin can mess up his mobility of his shoulder. I gotta write that down on my history taking. Visible scars on his bicep, here. I see some stuff on his calf. I can play with his skin all day. So that is why history taking of everything that has ever happened to him, gut problems, vision problems, balance problems, hearing problems, all of that I need to document down because all of that produce pain. So that's why the most important thing to take down is history taking and assessments. When I say assessments, it could be range of motion. It could be manual muscle test. For example, I'm gonna do a manual muscle test on his bicep. Now I'm gonna ask him to just give me a bicep curl and I wanna see if he's weak or not. So give me a bicep curl. All right, right there, and don't let me pull you. All right. Let's check the other one. Switch legs, switch arm. Let's see here, and pull. Yeah, that ain't going anywhere. So I did feel a weakness on his left. How about face that way again? And I'm gonna keep your elbow bent. I'm gonna keep this like this, and I want you to just give me 5 reps of wrist circles, and then 5 reps of the opposite way. So I'm just giving him now some mobility, proprioception, while I'm pulling his skin down and out. I can feel the muscles working underneath that skin. Let's check the, when we face that way, yeah. All right, let's see what that did.
Yeah.
Pretty good, right?
Yeah.
All right, now face me. And let's do that bicep on that left. Very good. And pull me. And that's a lot stronger. So if he got a weakness, where's the weakness coming from? Is it because he has a weak bicep, or maybe he's got something going on over there that most people have overlooked? So I test range of motion, flexibility, manual muscle testing, reflexes, vision, balance, such as Romberg testing. So we check all of that stuff in my mentorship program, and this is the stuff that I have charted down in the document for you for free, a download so you guys can see exactly what kind of assessments I do. to be able to collect data to help guys just like Ramon get back into the gym and press and lift with no problem. Download my free PDF on this guide for how we do assessments and for proper history taking. Sign up now so you can guys have a free download from me. Hopefully you enjoy it and hopefully this will help you in your practice. Here's an offer for you that you really don't want to miss. I'm offering a 1-month pass for my new Move Mentorship Program, 1-month free trial for the amount of $50, which is actually refundable if you find the material in my mentorship program not really relatable to what you're trying to achieve. So I'm offering for $50 access to my new Move Mentorship Program to the first 2 modules in which you're going to learn about functions of the brain, neuroplasticity, neurology, and breathing, as well as proprioceptive and motor control systems such as mobility. Check this out. It's only $50 to apply. Apply right now for a limited time. You have a 1-month access and you also get 1 coaching call with me at any time within this month to talk about any of your clients or any of your cases, or even about yourself if you're suffering from any injuries, or if you want to ask more about the mentorship program. So sign up now for this limited time deal for $50 to get 1-month access for the first 2 modules and plus any more other benefits that I have for you. Sign up now at the link below and I'll see you guys there.